Prior to beginning the actual foot assessment, the nurse will perform the following. A basic foot assessment includes screening for vascular, skin, structural, toenail, and neurological status. We will begin by assessing this patient's vascular status. First, we want to test for temperature. This is completed by placing the backs of 2 fingers against the skin of the foot and checking to see if the temperature is warm or cool. The next assessment includes assessing the color of the foot. Is the skin color normal for that patient's skin tone? Or does it have a bluish or red ruberous color denoting decreased arterial flow to the foot? Another element in the vascular assessment is assessing for hair growth. Hair growth denotes that there is good arterial flow and that the arterial flow can support hair growth on the foot. You notice this patient has good hair growth on the dorsal aspect of the foot as well as the toes. Next, we want to assess for edema. We want to assess around the ankle, the foot, and up the leg to assess if there is any edema, and then noting that if it was pitting or non-pitting. Finally, we want to assess the pedal pulses. We assess the dorsalis pedis and the posterior tibial. The dorsalis pedis pulse is found by taking your fingers and sliding it up to the top of the dorsal aspect of the foot and pressing gently against the bone to be able to palpate the pulse. This patient has pulses that are present and strong. Then you want to slide your fingers down medially and push gently up against the medial malleolus. Again, this patient has strong, present dorsalis pedis pulses. If the patient did not have pedal pulses that were palpable, we would then want to use the arterial Doppler. First, we want to apply acoustical gel on the dorsalis pedis area as well as the posterior tibial. You want to make sure that you apply enough acoustical gel that it gives you the opportunity to hold the Doppler in the best position without losing the gel seal to get the dorsalis pedis pulse. You want to hear a crisp, multiphasic pulse. Checking the dorsalis pedis pulse, you would do the same. Next, we will assess for the structural status of this patient's foot. First, you begin looking for any type of lesser toe deformities, such as hammer toes or claw toes. This patient has fairly normal straight toes. He does not have any bunions or bunionettes. Then you want to look for the structure of the foot and the arch of the foot, and you can note that this patient has a flat foot, and because it is flat, even when he is not standing on it, this is noted as a fixed flat foot, that it does not arch when he is not applying pressure to it. Next, we need to assess the skin status. As you note, this patient's skin on his foot is intact. We want to look for maceration in any areas of the foot, so I'm going to be looking specifically between the web spaces for maceration and or tinea pedis, which is a fungal infection that is found especially in patients with maceration between the toes. This patient's web spaces are clear and dry. Next, we want to look for any corns or calluses, especially on a hammer toe, such as the second toe here. And I note here that he has no corn being formed, but this is a risk, again, from having a hammer toe with it rubbing up against the shoe. Next, we want to check for fat padding. Is the fat padding that is normally found across the metatarsal head still there, or has it moved upward, leaving the metatarsal heads at risk for trauma and development of callus. This patient's fat padding has moved up a little bit, but there is still enough fat padding across these metatarsal heads that he is not at risk for developing callousing at this time. Finally, we want to look at the dryness of the heel, which is a very dry area. You note he does have some cirrhosis, but no fissuring, no cracking, and with moisturizing, this will be taken care of nicely. When assessing nail status, there are several elements we want to be looking for. First, we want to look at the length of the nails. We want to look at the thickness of the nails. We want to look to see if the nails are cracking, crumbling, or splitting. And most importantly, we need to assess for onychomycosis or fungal infections of the nails. This patient, you can see, has subungual onychomycosis in his great toenail and his fifth toenail. The fifth toenail has become thickened with some of the fungus coming out from the nail, but the great toenail shows that the fungus is encased within the nail and has not become quite as thickened. These nails can be difficult to cut and can split, especially as in the fifth toe, they become thickened underneath the nail. Finally, we are going to be assessing for neurological status. This is important, especially for the patient with diabetes and patients with other comorbidities that may cause loss of protective sensation in their feet. We are going to be using the 5.07 10-gram Semmes-Weinstein monofilament to test for protective sensation. First, you would want to show the patient the monofilament and maybe test it on their hand to make sure they understand it's not a pin and you will not be causing any injury or pain. The patient should be in a comfortable position, such as this patient, and the clinician should not be touching the patient's leg or foot to support it, as this monofilament is very fine, and that touch will detract from the patient's sensation. You want to test the foot in 10 different places in a random fashion, so the patient does not expect it to be in one place and maybe state that they feel it and they don't. You want to ask the patient to close their eyes, and then you want to use a 3-second test. I'm going to start with the great toe, and it will include a 1-second approach, a 1-second bend, and a 1-second removal. You would do this in a random fashion on 10 places of the foot. Each time you apply the monofilament, you ask the patient if they feel it. They do not have to tell you exactly where it is, just if they feel it. If the patient does not feel the monofilament in one place on the foot, he is deemed insensate and has loss of protective sensation. The 10 places that you want to check are the first, third, and fifth plantar surfaces of the toe, the first, third, and fifth metatarsal heads, the instep, the lateral part of the foot, the heel, and the dorsum of the foot. Try to avoid any thick callousing or wound areas because the patient will not be able to feel the monofilament. You would want to complete this on both feet.